Originally diagnosed with severe degenerative disc disease. I have arthritis that runs in the family, so having a bit of back issues was not really a surprise. But it wasn't until I was getting my second hip replacement, I'd had the left done and I was doing the right, that I started experiencing back issues. So I had them do an x-ray, and then when they told me it was pretty severe, I had them do an MRI, and that's kind of how I ended up here looking for advice and treatment. So I got the injection based on what we discussed, and we came up with a plan, and I had PRP and stem cell and epidural, and honestly, from day 2, I couldn't believe the difference. That really surprised me, because the hardest part, and maybe for a lot of people, when they get out of bed, with me, it was just, was it going to be a good day or a bad day? And I wouldn't know until I tried to put some weight on my legs. I had no issues with sciatica, no pain. This was all back. It was whether or not my back could support my weight. So other than a little bit of spasm, which was such an improvement considering where I came from, I just couldn't believe it. And each day it started getting better and better, to the point here I am 1 month, and we're just reviewing my results and deciding whether or not to maybe do another site that we didn't treat the other time. But at this point, we're just discussing it. And I can honestly say this has put me back in terms of my health and how young I feel by at least 10 years. I'm an interventional cardiac nurse, interventional radiology, and I wore 20 pounds of lead probably for about 25 years. So another probably reason I have my back the way it is. And, but also very active. I do Tai Chi, I walk, I hike. And so it was really important for me to get as close to that level of fitness that I was at before. And so far, very happy. Thank you.
Thank you for trusting us. And also you mentioned something, what was your expression? You went to heaven?
Oh yeah, he asked me how I did, and I said, well, I thought I died and went to heaven because I was pain-free. I just couldn't believe it after 2 or 3 days.
Great. And then, so I just mentioned you're a nurse yourself. So a lot of times they mention is placebo effect. So what do you think?
There's no way this was placebo. There's no way you could actually, I mean, first of all, placebos, I think in the end, you'll know they're placebo because the results will stop working. No, I'm telling you, it was just like being able to get my legs even up close to my chest. I couldn't do that, now I can. I'm able to do physical therapy, and so we're trying to strengthen my back muscles as much as we can, which I was totally unable to do prior to the tests, prior to the injections. No, there's no way it was placebo.
And then there were originally other doctors that offered you surgery. They were considering surgery, which was a little difficult.
You know, it depends who you go to. And my doctor, my primary care, who I adore and everything, she says, well, if you're going to see a surgeon, you need to see this gentleman. So I did. And actually, I have to give him credit. Initially, he asked me, he showed me what he would do, which scared the hell out of me because, you know, who wants screws into their back? And also, if you have arthritis, the way I do, it's not really, for me, a kind of a good treatment. So, but he did ask me, have you done this, have you done that? And I said, listen, I've done just about everything, I've always been active, but the spasms were getting so bad, it was crippling anything that I did. So I thought about it, and I thought, you know, I'd heard about stem cell, but then when I started researching it, I thought I had nothing to lose. Surgery will always be an option, but I better try this first, and I'm so glad I did.
Yeah, good.